Hi, this is Dr. Dan Purser. Sorry, I'm a little hoarse tonight. It's because I'm actually sick. I've got a cold, summer cold, so I apologize. But there was no way I was going to miss this again. We because of electrical difficulties and everything last week, we had to cancel it and reschedule it. I am not going to miss this again. So this is about the top 3 international system. Sorry, I can't read straight because my vision's blurred from my cold. My top 3 interstitial cystitis tips of all time. This is incredibly important. I'm debating with the team here that this is probably the most important Facebook Live I've ever done because it's going to really reach out and touch some people and allow them to change their lives in really positive, easy ways that will just give them a new life back. Tonight we'll talk about new urine testing for interstitial cystitis, new pain options that are just really off the charts, a new diet that actually works. So let me do my introductions first, though. Jackson's right across from me here. Mm-hmm. You went and saw Jared last week, who's going through medical school in Clearwater, Florida. Is he still dating someone? I know he's like a silent dater, never says a word to his mom or I. So what's the story? Is he dating someone?
Not that I know of, and not that it's really important anyway, but he's doing good out there. I will say that.
He's trying to get the tea out of us, huh?
What's the tea?
You don't know what the tea is?
Is that gossip?
Yeah.
Well, he won't tell us. Yeah, I'm going to make it through tonight. So across from me is Jackson, and by her is my lovely assistant, Brecken, who's really kind of set this whole thing up. She's done all the legwork on it. So, Jackson, I sound terrible. Oh, my gosh.
You do. You really do.
Well, yeah, but can you play the theme song? And Brecken, can you sing along or yodel? I can't.
I thought you were going to yodel.
I can't sing tonight. Brecken?
He was waiting for me to sing.
Give you a chance.
That's a Star Wars theme song.
Star something song, yes.
Oh, you change it every week. So, medical thought of the week. This is amazing. Amazing. The medical world changes dramatically every week and every day. 130 years ago, urine culturing was developed. And now we have urinary genetics testing for bacteria. This is beyond next step. This is so the answer to prayers, and I love it.
Did you make that up yourself? Usually it says by Gandhi. There's no quote.
Who's Dante?
No, Gandhi. I don't know.
Gandhi was a physician.
I thought you quoted him before at one point.
I don't know who that. Someone really smart made that up. So
sounds like you.
I'm still waiting to get to do one of my graduations at the high school I came from. I mean, he also said so many #1 books on Amazon, spoken all over the world, practicing physician, started biotech, made products for various companies. And yet I don't ever get asked to do graduation at Bixby High School. Okay, anyway, I'll shut up. Okay. Jackson, you need to announce that sale, the continuation of the sale.
Yes, the methylation month is ending at the end of this month in May. So that's just tomorrow. Yeah, Memorial Day. Everyone was asking if we were doing a Memorial Day sale, and we just have
Here it is.
methylation month ending.
Hopefully I'll live through it.
So that includes our MTHFR products. They're still 3 for $100. Tiny Vite is $15 off still.
Mm-hmm.
And then we have some testing on sale still. Pro 7's $50, SpectraCell's $50 off.
Wow.
And the methylation kit is $25.
So I'm not paying you guys this month, right?
No, we're starving this month.
Okay, good. We're starving.
But
Hey, I was going to say something really smart, but a cold destroyed it.
So yeah, great sales.
Cool. Oh, yeah, I'm using oregano. Your mom and I both have been using oregano essential all night. That will burn the hair off your tongue, but it prevents you from coughing up parts of your lung. Yeah.
He keeps joking
numbs.
all night about coughing up his lung.
It is
I
worrisome.
need to get back to my
we're getting a little
oregano.
scared.
We make an oregano tea. It worked with one of our daughter had whooping cough. It worked really well. It's the only thing that worked
Yeah.
to suppress her crazy coughs every night. It has a drug-resistant whooping cough that got brought into the country. Okay, we'll leave that alone. Okay, so Brecken, start this incredibly awesome educational event.
Let's do it. So, what
Should I move? Wait, should I move closer to the microphone?
You're good anywhere.
No, my nose is starting to run. I don't want to get it on the microphone.
We can disinfect
You're
it.
getting up
Sorry.
and close with Dr. Firster today.
Wear a mask. I should.
Let's do it. What's IC? What is IC?
Interstitial cystitis. It's really a severe inflammation of the bladder. It's like you have a bladder infection that never goes away. Constantly there, constantly pulsating, constantly causing you pain and agony. Women get these cultures. They're always negative. Over and over and over again, they keep getting the same culture results, negative. And they're finally just told you have IC. Eventually ends up with removal of their bladder. It usually goes along with fibromyalgia. Why that is, I do not know.
Yeah.
Probably genetics, I think. I'm going to drink some water.
You're good. Drink
Sorry.
water. So, do you know
Brecken gave me some cough drops. They're not the kind I like.
what kind do you like? Those
The Young
are-
Living cough drops.
Oh, sorry.
These.
I'm fresh out.
These cough drops.
I just had sugar
But I was
free.
just afraid if I started sucking on one and started coughing, I'd swallow it and they'd be Heimlicking me on the air.
He
It'd
had
be
this
horrible.
whole thing in his head that he thought he was going to go viral on YouTube with us saving him doing the Heimlich maneuver, but I don't think that's going to
We're
happen.
going to get this done. Please forgive me. I'm just really want to get this out there. So please forgive me. I know I'm being gross and sick. And it's terrible.
But it's okay. So what is the root cause of IC?
What we think now or what we thought a week ago?
Both.
We didn't know a week ago. It's some kind of horrible inflammatory process. There have been so many studies and theories on it, but no one can figure it out. What I think now is changing the whole dynamic. This work that Microgen DX, which we're going to talk more about tonight, has done with their culturing and their biofilm discovery and stuff like that in the bladder, hiding the bacteria, so you get negative culture results, is a huge deal. I think it's chronic bladder infections. So I think 30% we can't get any positive culture results or Microgen DX genetics results with their bladder bacteria. So 30% maybe really indeed do have some mysterious unknown cause for their bladder inflammation.
Yeah.
But the rest are infections that have never been diagnosed properly.
Never been found, right?
Right, and that's what this is about tonight.
So that's why this is a new development for treatment of IC, because it's so much deeper, so much.
I don't know about deeper, what you can hide the culture results, you can hide culture growth with the biofilm. So yeast and fungus are always involved in this process. You got a yeast or fungus in your bladder, and it hides bacteria underneath the biofilm it creates. That's like a super force field around these bacteria. So they don't come out in culture, they don't grow out in culture. There's tons of studies on them. Where are all those studies? They gave you a whole pile of studies.
I got a whole.
We looked up, and the
Yeah.
Microgen DX people gave us. It's crazy. So this actually shows you the actual bacteria, the yeast, the fungus, because it finds their DNA. It doesn't care if it's not gonna culture them out anyway.
Yeah.
But it discovers they have a system for discovering in your urine all the bacterial DNA and the fungus and yeast DNA and what the genetic patterns show that's resistant to and everything else. It's really detailed. Like here's some reports here, so you can see them. I know we're going to post some of these so you can get a better look at, but it's really complicated. Here's the culture results on this patient. Here's the sensitivity and antibiotic suggestions over here. And guess what? They get better.
Yeah.
It may be, 15 days of antibiotics, but they still get better, and they get rid of their IC. They get rid of their IC because the bacteria finally are discovered and uncovered that cause it. This is groundbreaking. This is earth-shattering
Yeah.
for IC patients. That's why I've been so excited to get it out there. So if your doctor does Microgen DX testing, great. Get it. If they don't, you can get it from us. So however we can help with this, we want you cured. If you might be in that 70% that get better,
Yeah.
and it goes away.
So what you're saying is this is actually just chronic bladder infection that's really never been caught.
Right. No matter how the quality of the culturing that's been done, all that, it's really, it's really, all these good doctors have tried. I know I've tried in the past too. Wow. I'm shocked. So, so the Microgen DX, they were originally named Pathogenius. You can look them up. Go to their website. You have to have a doctor who's part of their system and been approved and everything by them, but to sign off the lab result. So if your doctor isn't or doesn't want to, that's what we're here to help. But hopefully your doctor will when they figure out what the quality of this stuff. They're the only ones who do this. They have a library of like, was it 50,000 or 500,000? Some huge number of bacteria, yeast, and fungus that they have the genes for now. And it's crazy, so
why can't regular doctors, why haven't they found these infections yet? I know, like you said, these IC patients go through so many years of trying to find these, but why is this different?
They don't know about this testing. And it's simple. You just get a urine collection. And I'll show you the kit and everything here in a minute. And a vaginal testing. So it's really 2 sets of tests. And we're really testing the genetics and the drug resistance and the genetics of everything in there. It goes through a couple different pathways. So you do it twice, vaginal and urine. To really discover what the heck is going on in your bladder.
Yeah.
And it works really, really well. So
it's crazy.
Yeah.
What is second generation PCR testing?
I really have no idea. It's polymerase chain reaction testing, but it's the newest generation of it. And these guys are masters at it. It's a molecular biology technique that amplifies a DNA-based pair sequence up to several orders of magnitude, billions of trillions of copies. So it can find all the bacteria in there. It also does multiplex formatting and amplifies the DNA of multiple organisms in a single reaction. So it can show you all the bacteria in there, like this test result. This one only has like 4 on there, 3 or 4 on there, but let me show you another one. Sorry, I'm just flashing these up here. This one has 6 on it that were discovered in the lady's bladder. So they've been hiding there for years. No one knew. Little rascals torturing you.
Making trouble.
God. So
the bacteria usually hides behind a fungus or a yeast?
Right. They kind of go together. So it hides behind the biofilm that the bacteria yeast create, or the fungus or yeast creates.
What's a biofilm? You said that before.
Yeah, it's like a super force field thing that hides everything behind it that they create. So you can't tell, you can't grow the bacteria, but you can find pieces of its gene floating around in your urine.
Man.
So
that's so crazy. Technology is getting so.
This is really cool. This is, I think, 70% of the women and men with IC can be cured.
Yeah.
Why isn't this on the front page of all the newspapers and everything? It's a big deal.
Yeah.
There's millions of Americans with IC.
It's crazy.
It's horrible. It's a horrible disease.
Yeah. So what's the company that offers this test again?
Microgen DX. And it does test for drug resistance, and you can find multiple pathogens. I'm going to answer some of these questions for you. So.
And this is a culture they do. You kind of said that it's urinary.
Not really a culture.
Yeah.
Not a culture.
Okay.
They're taking your urine, they're spinning it down, they put it in their multiplexer, and it spits out all the gene codes for the bacteria it finds and the yeast and fungus it finds. And then you can treat it all. Problem goes away. Finally.
And like you showed, it finds multiple pathogens. It's not just like one thing.
Right. Or it can find bacteria they don't realize they're even a pathogen.
Yeah.
But because there's so many of them in there, they become a pathogen.
And what if it's like bacteria or pathogens that like I've never heard of before? Or
yeah, some of these are.
Yeah.
Still got to treat them.
And they are treatable?
Right. Like this one was treatable with cephalexin, which is Keflex, 10 to 14 days. Also deals with chronic prostate infections that can't be discovered too. Same concept. This one was sulfa DX, Scepter DX, trimethoprim sulfamethoxazole DS, which is really old school, but it worked. So it's crazy.
Because it's so specific. Every person with IC, they all have different bacteria that's causing
Not
this.
all.
Or,
70%.
Yeah, 70%.
Maybe 30% do too, and we still can't pick it up.
We
But
haven't found those
70% do. So 70% of the people listening tonight can probably benefit from this. I think they would benefit from this.
Yeah.
That's why I'm like, order it, or go talk to your doctor, get the testing done. It's the dual vaginal swab, urine collection, testing from Microgen DX for IC.
Yeah. So, what's the best way for patients to get this?
Call our office or go to your doctor. Our office, or email you, or we can have them email you.
Yeah.
Email Brecken at aespmi.com.
Yeah, that works.
Or info@danpursermd.com.
Or we'll be in the office tomorrow. Specifically, I will be at the
For
front
this.
desk. So just give our office a call, 801.
We'll get it shipped
796-7667.
with all the instructions.
Won't get it shipped out tomorrow because it's a holiday, but we'll start getting them shipped out on Tuesday and Wednesday. Just getting them
Right.
out. But yeah,
Yeah, and then about 2 weeks later, we should have all the results back.
actually, based on when you send it in, it should be within the week.
I know
Okay.
they say that, but
It always gets slowed down.
I'm saying
That's
by
what
the
we
time
find.
they contact us, and by the time we actually sit down, if I'm going to treat you legally and everything, you got to come in here. You got to come and see me once.
Yeah.
So that may mean you have to fly in, or you have to fly in to get the urine, but it'll only be one visit. Once I lay hands on you, if you happen to travel somewhere or be somewhere else, you're still my patient.
Yep.
So I'm sorry about that. What a nightmare. Or we can get you going, then you can fly in when you're more stable, once we stabilize you and let me fulfill the letter of the law.
Yep. Is there a certain way that these patients should be performing this test at home?
It's a little bit complicated, but yes, absolutely. This is all going to be posted, right?
Yep.
In the next couple of days, we should have it out with the video, but we're going to have a PDF of all my answers.
Yep.
So first, my eye's twitching. I need choline. I just was thinking that today. I see it twitching. Okay, first, if you order this test, you must find the FedEx hub for overnight shipping in the area. You're paying for that overnight shipping. This goes overnight to Lubbock, Texas. Also find out when is the last minute that FedEx will accept a package for overnight to Texas. Get it there before then. So if they say 5 p.m., we got to have it. We got to have it in the truck, and at least for the plane, for the airport. You got to have it there by 4:45. So second, no suppositories, no vaginal suppositories for 24 hours prior to collection. Don't take any fluids for 2 hours before collection of the sample. And you cannot use or take in antibiotics, probiotics, or use lidocaine the 24 hours prior to
That
collection.
one's actually 48 hours.
48 hours.
Yep.
Okay. Well, can you change that?
Yep. They want it out of your system at least 2 days.
48 hours. Good. Even though it's not a culture.
Yep.
Then wash yourself thoroughly down there gently with warm soapy water and rinse well before collection. Then do the 2 vaginal swabs first. Let me open the kit. Let me show you the kit. Come in a box like this. FedEx shipping's here. So you prepay for it because it's going to go overnight to Lubbock.
Yep.
You open the box like this. You make all kinds of fun sounds because we're going to change your life, right? This is what you pee in. Little cup. The lid screws off. You pee down in it. You try and get it up to about the line, top line here, right?
Keeping it sterile and clean, making
Keep
sure
it
you're
sterile and
not
clean. Be
touching
really
into
careful. And then you peel this little yellow thing off when you're ready to collect it and send it to the sorry. Let's do the vaginal thing first. This is the swab. There's 2 of these in there.
it. There will be 2, yep.
Yeah. So you take this out and you swab.
Mm-hmm.
And inside your vagina. Sorry, we need that data to do this right. And then there's a yellow tube in here, and there's a bag for the yellow tube. You'll put it in. But this, you peel off this yellow sticker on the top, peel it off. You hold it like this. You insert this down. Fill the tube up halfway, about to the bottom of this top of this label, like this. It's a vacuum in this tube, so it'll suck it up in there. pull it out. Don't overfill it. Fill it halfway. Then put it in this tube, wrap the bag, wrap it up really good. Put the paperwork that'll be in here with it inside the sleeve here. And then you take it to FedEx.
Yep.
Seal it up good and get it to FedEx for overnight to Lubbock.
And we'll do another video with all those instructions. They'll be posted in that PDF, everything. So don't worry.
I know it's a little bit complicated, but it's easy once you know
Yeah,
what
it's
to
really
do.
not that hard. Yeah,
Yeah.
thank you. Oh, yeah, easy for me to say. I'll be sitting here while you guys do all the hard work.
And is this test only available in the U.S.?
No, we can ship it anywhere in the world. It's got to be back within a week to 10 days to Lubbock.
Yeah, I gotta figure that one out exactly, but
They'll have to pay for the
Yeah.
DHL
Yep,
or whatever, probably DHL to get it
Yep.
to Lubbock. Okay.
that's correct. And then you told your followers that this was a 3-part IC Facebook Live event.
It is. It is. So more groundbreaking information. We've developed a topical pain gel that it's going to be sold as an OTC, but we want to confirm. We've done some amazing things with IC with it. We want to confirm that we're going to do a 30-patient double blind. It's free for you. Double blinded, meaning we don't know who gets it, who doesn't. The first week and the second week, everyone crosses over. So first week, half get it, half don't. They'll get a lidocaine gel, which doesn't really help. Second week, there's a crossover that occurs, and so you get it either one week or the other. There's a 3-day clear out in between. It's not me running it. It's Dr. Donald Harley, and he'll be running it, third party. But we just want to see what it does, how well it works. All you got to do is answer a questionnaire every day and date it and make sure you answer all the questions. And then we take that in at the end of each week. There's no compensation for it. You'll just help millions of people with IC because we think it works amazingly well, and you'll know it. You just apply it. It's just a gel you apply topically over your bladder, and it's super easy to use. It's all natural. It's good for you. It's good for your kidneys, your liver, your lungs, your heart, your eyes. It's good for everything. If you have arthritis in your hands, you'll notice it really helps with that too. Anyway, just throwing that out there. Super safe to do. We'll talk to you about that. We'll have you sign the NDA and some other stuff. We already have, you think, 20 people for the study.
Yeah, a lot of you guys have already reached out, but keep reaching out and we'll enroll as many as we can in the study. We're just still, getting it all ready. But
So, yeah, 13 to 15 more could definitely fit into the study. So, because we'll have some drop out. So, thank you. But the gel should be available on the OTC market probably in 120 days, maybe 150. We don't know for sure. We're just guesstimating. Or less even, but we'll see. So that's our big goal.
yeah.
So,
And right now we're just focusing on an IC pain study. So I know I'm getting a couple comments about other kinds of issues, but right now we're just trying to get IC. So email us if you have IC. Yeah.
also not just IC for that anyone with chronic UTIs that
Yeah.
can't ever get cleared up.
That too.
Not the pain gel, but this
The test kit.
Microgen DX test kit would be amazing for you. Again, see if your doctor or doctor in your area can do it. Or we're here to back them up or help.
And would men be good to get that kind of testing
Yeah, if
too?
they have chronic prostatitis or chronic bladder infections, yes. So let's talk about the diet.
Yeah, let's do it.
That's the third part of this. So I know that a lot of my IC patients don't like the diet. They said it made them worse that they normally put you on.
The
I think-
low acidity one or something.
What was that?
Is it a low acidity one?
Yeah,
Yeah, I can't remember.
but it's high copper.
Yep.
So I think IC has a lot to do with copper toxicity. I think it's why it's part of the whole fibro universe. Everyone with IC appears to have fibromyalgia too. They may say, no, I just have IC. Really? Do you have migraines? Your stiffness in your back and shoulders? You you have fibro, maybe mild, or maybe you don't notice it because your IC's is a level 12.
Yeah, it's causing all
while
the
your
pain.
fibro is a level 6 or 7. You don't notice it. So one thing I would like to refer you to try is the low copper diet. You should get it at the Facebook page, End Fibromyalgia with Natural Options. It's free. Download it. That's actually my page, but Lois Schweigert runs it. She does a great job. I don't really go on there very much. I set it up just to help people for free with fibro. But it's a great place, a great resource for you, and you should get that low copper diet and get on it. Try it. You'll love it. My IC patients all use it and believe in it. So it's just a low copper diet. And figure out what I've been saying about fibromyalgia. I'm too hoarse tonight to really delve into it very much. I'm sure you can't even understand what I'm saying. Are they saying that?
Yeah, a lot of people, they've just been suffering for
No, they
years.
can understand you
Oh,
fine, though.
that's-
You're
yeah.
good.
Okay, sorry.
A lot
I
of
thought
people
you
have been
were talking
suffering, though. You're
about-
totally right. Yeah.
So I think it's always part of the IC picture. You may also want to try some molybdenum or copper balance or the glutathione or something. So just to see if any of that gives you relief. So
Is it always a part of IC that you found?
I have, yes. When I have gotten rid of all their IC pain, they still have fibro pain.
Yeah.
That's in our recent clinical case studies that we've done with that gel.
Mm-hmm.
I'm like, wow, we cleared up but now you notice your fibromyalgia finally.
Yeah.
Yeah, I do. I'm like, oh, sorry. Yeah, we'll deal with that too. But
So basically, you're rethinking the think on this.
I am. But this data, this isn't me. There's a lot of articles you can go to. Maybe you could post the names of some of those articles or have Will do it
Yeah.
so they can look them up.
Yeah, we can just link
Yeah, there's
everything.
studies, that show all this. And go to the Microgen DX website, and we'll post it on there too. So you can go look at their studies and information they've got. It's legit. They're really amazing. Man, I think someone there deserves a Nobel Prize in medicine, but they'll have to take mine because I want it for fibro.
So I've gotten this question a couple times. I know we're not doing like a Q&A, but I think this is a good one to
Yeah, I
ask.
think we should do some.
Once you do like the microgen test and you follow their recommendation for dealing with that bacteria that's found, do you find that IC reoccurs again, or
Yeah, if the bladder infection or bladder infection comes back, I'm sure it would.
yeah,
I know I've only treated about 3 patients with it so far.
yeah,
This is really new. Like this is
Brand
is just
new.
getting out there.
yeah? It's new technology, new everything.
Yeah, it's really new. But it's been used for a couple of years, 3 years, I think,
Yeah.
by various universities for urological studies.
Yeah.
And it's worked really well. It works really well. It can clear up your IC.
Yeah.
So it's worth a try.
Yeah. And how long do results take to come back?
Well, we talked about that 2 weeks,
Yeah, that's right.
roughly. But the big question everyone's going to ask.
Yep.
Yeah, it's $399. It's more than we originally thought. I thought it was $215, but it's really 2 tests. So we even discounted that a little. It's the urine and the vaginal swab goes through both the PCR and the INGS testing.
Yep.
So yeah, you're really getting 2 sets of tests, but you got to do them both. You get the clear picture. And some of you that are really severe, or if it doesn't clear up the first time, you may want to repeat the urine culture. Not culture, but the urine testing. Sometimes you may need as many as 4 to find it out,
Yep.
to dig out what's in there.
Get the biofilm.
That's rare, though.
Really rare, yeah. And just to confirm, they do need to come see you.
Yeah, that's the law.
Yeah. There's not like they can't Zoom. It has to physically.
They can Zoom me for the first couple of visits,
Yeah.
but they're going to have to come out here and fulfill the law.
Okay. Sounds good.
But also know that people with bad IC can't even leave their house. So
I know.
what do? They have hard enough time going to a doctor.
Yeah.
So what we can do as soon as they get stable enough, they come out, see me.
So this is a good question. So someone said, can you clear up whether IC is caused by an initial UTI that became chronic due to it not being treated correctly initially? Is that basically what this is?
Yeah.
Pretty much.
Or repeat or recurrent UTIs that have occurred with the yeast or fungus, and they're hiding behind it.
Yeah.
They work together to destroy you.
And that's the other thing I saw. Someone else, they were like, I only had one infection ever diagnosed. But like Dr. Purser said at the beginning of the video, this test is looking at so many deeper bacteria, or like different than just what your normal doctor's going to culture you with. This is something so much deeper. And so that's why you might not have ever been diagnosed with an infection, but you actually do have one that's hiding back there.
That's what they're saying.
Yeah.
That's what the genetics people are now saying.
Yep.
They're like Microgen, Pathogenius, all these companies.
That's what they're seeing.
Yeah, and that's what they're seeing. That's what the urologists are starting to see too. I'm not the only one. Clearly, I'm not the only one coming out with this. I just have a reach that a lot of them don't have.
Yeah.
So when I go right to you guys.
And there's not like a specific bacteria that they're finding for every one person that has IC.
No, it's usually 4 or 5, 6 or 7 or 10.
Yeah, there's a lot of different strands.
Yeah, and they're all hiding behind some yeast or fungus film, which is horrifying.
Yeah.
It really is scary.
It is.
But they just couldn't ever get the culture results out because they were nullified by the yeast or bacteria biofilm or fungus biofilm.
Yeah.
Good questions anymore.
This is a good one that kind of relates, but just to talk more about microgen, do you think this test could find any other bacteria that reside in other parts of the body?
Yes.
Not this test specifically, but they have like a nasal swab.
The sinus infection one's really good. It's what I've used this company for in
years.
wound infections that no one can figure out. Remember, I deal with complex wound issues, so, but you see, your bladder is really just a big wound.
Yep.
And this stuff's hiding in there, but it's the bioculture in the bladder is what's really weird. What they're finding out, that you get multiple bacteria and they hide behind biofilms. Yeah. Which is so strange. Can't believe we're having this conversation. Yeah. This is what the data showed. So. Yeah. And so so when they get your urine, they'll blend it up. I don't know how they do it, but they have some kind of way to do it. And then it concentrates all the genetic material. Then they look at all that, and then up from the various pieces and stuff they find where it matches in. You get the sequencing thing going on. The multiplexer must be incredibly complex computer equipment.
Yeah. No, this was.
I may need to do a lung culture.
I'll do that for you. That sounds fun.
No, we'll pass. I'll pass.
That sounds like really fun.
No, we're not going to do that.
He doesn't like it when I want to do weird cultures on you. Get your
we're not
lung.
going to do that. Don't make it weird. Go ahead.
Basically, we've done it all.
The OTC pain gel will be probably available anywhere from 4 to 5, 6 months, but it's going to be available. Yeah. Yeah, we're already approved to have it as an OTC.
This is one good last question. So with the probiotics, should they stop eating yogurt?
Yep.
Okay.
I wouldn't eat that for
But yogurt is good to eat in general. Yeah, just when you're about to do this culture or this test, stop it.
It's not really a culture.
I know.
I call it a culture too. I know. I thought for a while it was a really cool culture.
Yeah, but it's not.
And these guys sit down and educated me. I'm like, okay, I'm an idiot. Yeah. I was really. So the Facebook page is how to end. What's it called?
End fibromyalgia with natural options.
Yeah. End fibromyalgia with natural options. Download the low copper diet. Lurk on there. It could save your life and give you a much better life. You definitely want our pain gel. And if you get in that study, do it. Yep. And everyone that gets in the study will give you some kind of reward. Like when we come out, no, nothing. You're going to get a badge, a medal, a stamp.
You can send them a stamp. Good job.
A golden star sticker.
No, we just want you guys to be able to be a part of our study.
I can't promise anything.
So email our office.
Facebook will get mad. Any other questions?
We'll come through and answer them. We'll have you answer them later too.
Rest your voice.
Yep. You've seen patients tomorrow.
I'm going to go pass out somewhere.
Oh, are you?
In the car on the way home.
No. But it was great. I think that's.
Thank you. Sorry I'm so sick and hoarse. But I want to make sure this data got out here. Spread it around. Tell everyone to watch this video. Tell them that I am sick so they don't make fun of me. I know my voice is bad enough when I'm not sick. So, thank you all. I love you all. I think this is really good data. See if your doctor does as they can. I'm here to help. This is Dr. Dan Purser. God bless and go in good health.